Cancer Guidance by Type, Part 29. Dr. Dilip Gadgil, Pune. Brain tumor. Most of the patients who come to us have already undergone the mainstream treatments, including surgery, radiation, and sometimes even chemotherapy. By the time they get to us, their cancer has already reached an advanced stage. At this point, improving the quality of life is all that we can work towards. I encountered a very disturbing case of a little girl. This 7-year-old girl was diagnosed with cancer when she was 5. A year later, cancer relapsed and radiation was given to her. The next year, the tumor again became bigger in size. She was in Mumbai, so we went to visit her. She was surrounded by pillows on 3 sides, on which she had rested her head and was crying in pain. It was a disturbing sight. She had a massive headache, her bowel movements had been off the mark for 5 days, and she couldn't eat anything. I thought this might have to do with her previous life. I told her parents that the best we could do was try to make her quality of life better, but it's better if she passes away. Well, we didn't really have to give her too many medicines or treatment because she died within a week. When something like this happens to children, it is a very serious and disturbing problem. On the other end of the spectrum, I know of 2 patients who didn't do anything at all. Since the knot was way inside, surgery was out of the question. Reaching the tumor was tough, so radiation and chemotherapy were also not feasible options. So, they didn't do anything about it. They simply took our medicines. I had another case where a woman didn't get her periods for 5 to 6 months. A doctor had told her to do a brain MRI, suggesting that there was a tumor that was suppressing the pituitary gland. He also told her to consult a neurosurgeon, who in turn told her that while it was difficult to do a surgery, he could still give it a shot. I advised against it. The patient was kept on milk and medication. Later, we did 2 MRIs and noticed that the tumor size was the same as it was before. Her age was close to menopause, so the period problem was anyway taken care of. In another patient's case, I decided not to suggest surgery and simply continue our treatment and medication. His fits continued while we administered Ayurvedic medicines. He was simultaneously taking some allopathy medication, too. While the tumor didn't go away, it became smaller and weaker. Basically, medicines can help control this disease, and this must be kept in mind when seeking treatment for brain tumors.